Welcome. This is Health Matters, and I'm Barbara Marcum. With me today is Dr. Carron, who has been on my show before, however, is an ear, nose, and throat, otolaryngologist.
Close, but no cigar.
Okay, what is it?
Otolaryngology.
Otolaryngologist.
Ear, nose, and throat surgery.
Ear, nose, and throat surgery, yes. Okay, so we did a show on that, but what I didn't know at the time is Dr. Carron is also, he does trauma, and he has special training in anything from the collarbone up, as far as surgeries, reconstruction, all of that things. Let people know, like, your background. You're on the faculty at Wayne State University. Let's know a little about you.
Okay, well, so basically I'm an otolaryngologist, which is the long definition of an ear, nose, and throat surgeon, but I also have an area of subspecialization in facial plastic surgery. So in the core training of an otolaryngologist, we do facial plastics, reconstruction, and things like that as part of our training. But I decided to do additional training in New York City at New York University in facial plastic and reconstructive surgery as a fellow at Bellevue Hospital, New York University Hospital, and Manhattan Eye, Ear, and Throat Hospital, Lenox Hill Hospital. And essentially, between all those places and my faculty, basically the mentors, I concentrated on cosmetic surgery of the face, and the head, and the neck, facial trauma and reconstruction, and then reconstruction for cancer defects and things like that.
Well, I found this very fascinating because everything that you see, God, they're a pair of twins on TV, their lips are huge, right?
Yeah.
And it's like, oh, okay, well, the surgery that you don't want. But what I wanted to do this show because beauty treatments, okay, whether it's Botox, whether it's fillers, whether it's peels, whatever, are like big right now. People are always looking to improve themselves, which I think can be rather addictive. Okay, but I'm sure you've seen that before. Now I want to do this, and then next I want to do that. Before you know it, it's a whole different person. However, okay, so I wanted to talk to somebody because I know you do a lot of procedures, and I want you to explain what procedures they are, what they are, and how you do them. But first, I want to talk about why you don't want to go to a neighborhood Botox party.
Well, ideally, there are a lot of people that are performing injections, whether it's Botox or fillers, and people have different degrees of training and expertise. Mm-hmm. So I think it's important to go to somebody who is obviously licensed, who has particular training in this, and has significant experience and expertise in the use of the different products and materials, yes, and also has a tremendous understanding of the facial anatomy. Not because, well, obviously you want to get the best result possible.
Sure. But
these are not innocuous substances, especially the fillers. There are certain veins and arteries in and around the face that they can be compromised, damaged, and cause serious problems, including blindness or major skin death around the face.
Paralysis, if it's Botox hitting a nerve.
Yeah, you can have temporary paralysis in an area that's unwanted, but the real things to be afraid of are injections in the nose, around the eyes, around the forehead area, and in and around the sides of the nose, where there are really important blood vessels that can be, the material can be injected into them, and it can actually choke off the blood supply to whole parts of your face or even your eyes and retina. So
would that like cause necrotic tissue?
Yes, exactly.
Oh my gosh, that'd
be awful. It happens for sure. It does. And it can happen in the best of hands, but it's one of the risks.
Your chances are a lot less.
Right. I would think so.
Yeah.
You have to be very judicious with the use of these. It can be very casual because it looks so easy and you're just injecting and filling here and there, but you really need to know the anatomy. There are facial danger zones that must be avoided, and you have to be very judicious when, in and around those areas. God forbid something does happen that's an untoward consequence. You need to know exactly step by step and have all the materials basically in a little rescue kit to make sure that you can get a handle on the situation.
Really? I didn't even know they had those little rescue kits.
Yes.
Okay. Let's talk about, okay, I want to talk first about some things that are covered by insurance, some things that occur as people get older, like the heavier lids, and that can impair your ability to see. So let's talk about those.
Okay, so it's actually a really good talking point. So not everything is a Beverly Hills $20,000 rhinoplasty or a Miami, Florida $50,000 facelift or a New York City $200,000 facelift. Some of these things are covered by insurance. If there are issues with the face, especially like you said, the eyebrows maybe have dropped significantly to where they're impairing someone's vision. The upper eyelid skin can be excessive or dropped, impairing vision. Many times after clearance and evaluation and measurements taken by an ophthalmologist, if it's a legitimate functional deficit, meaning it's not purely for the looks, that can usually be covered by insurance for correction to improve vision or visual field, things like that.
Okay. What is that procedure that we talked about that happens on the nose that you were talking about?
Yeah, so there's a skin condition in people where the skin of the nose and the face can get rather red and thickened. The most extreme example is like W.C. Fields, where it looks like there's like red broccoli on the end of the nose.
Yes.
It's called a rhinophyma.
Right.
Usually the patients we see aren't that extreme, although I do have a few. But the condition's called rhinophyma.
What's it caused from?
It's where the oil glands in your nose and tissues on the nose, cheeks, and chin can become very, very inflamed. If it's not on the nose, it's called rosacea. On the nose, it's called rhinophyma.
Okay, yeah.
And there are treatments for that. There's some topical medications and ointments that can be used. We're lucky enough in our practice, we have a special, it's part of a laser machine, but there are certain chips that get put into a handpiece with a certain spectrum of light and photons that can target all that red stuff, and basically slowly over time we can get rid of it after a series of treatments basically.
Okay, when we talk about things, we want to talk about Botox, fillers, and peels. Okay, so I am curious, what is Botox actually? Is it all the same thing, or is it made of different things?
So it's an easy and complicated question. So
Okay.
Botox is basically botulinum toxin. So somebody gets botulism,
Yeah.
that's basically Botox produced by a bacteria called Clostridium, and it's an anaerobic bacteria.
Okay.
But there are different subtypes or serotypes of the botulinum toxin. So it's not like there's one, there's like at least 7 of these things.
Okay.
And back in these were isolated compounds, I think in the late 1800s, early 1900s. Then they realized it can be used to induce a temporary weakening or paralysis of the muscles.
Right.
And then I believe it was in the 1940s where they were using it to inject eye muscles in people with what's called strabismus, where the muscles are pulling the eyes
I read about that.
in an unwanted direction.
Yes.
Because there weren't really good treatments back then. And then
Right.
they realized it could be used for other things, including muscle spasms. And in I believe it was the early 1990s, they realized it can be used to help with wrinkling, of the forehead and around the eyes and between the eyes and things like that.
I actually,
But there's different brands.
oh,
There's a Botox, it's trademarked, called Botox.
okay.
It's a bit of the generic term, but there are other products out there that are basically siblings or kissing cousins with slight different biochemical components to it. They act in a similar fashion, but they're slightly different. So some may act more quickly, some may last longer, and the prices can differ as well.
Okay, if you have, I know a guy who just had Botox, and I can tell you this. He'd lost a lot of weight. He had big creases in his forehead. The last time I saw him, smooth as silk, and I was telling him I was going to do this show with you. He goes, I get Botox. And I said, you do? He said, yeah. And I said, yeah, I did notice that, but I thought, oh my goodness, right? So anyway, it looked great. I mean, it took 10 years off his, But anyway, it looked, okay, so I'm not going to ask you which one you prefer, but is there one of those that you prefer over
There
others?
is one that I've got the most experience with,
Okay.
and I feel like I get the best results with.
Okay.
Yeah.
So that's the one you use on a regular basis.
Pretty much routinely, especially for anything cosmetic. There are insurance cases where we use Botox for chronic migraines, muscle spasms of the temples and the jaws, and terrible headaches back here that you can actually inject to take what are basically very tense muscles or little Charlie horses and relax them. Usually, if it's going to be an insurance case, they require the use of one or two of the available options for that, where it's a covered benefit.
Okay.
But they kind of mandate or they'll dictate which product you have to use.
Yeah, it's different than cosmetic. It's a medical necessity, pretty much. Okay, so let's talk about fillers. Now, that was what I was really looking at, as far as, because it could be this and it could be a combination of this or a combination of a synthetic and it was just fascinating to me. So what is a filler?
A filler is usually, well, there's different types. The main ones we use, without getting too deep in the weeds,
Yeah.
the main ones that we use are made of what's called high hyaluronic acid. It's a biochemical compound. It's found in our tissues everywhere throughout the body. So you've got it, I've got it, everyone's got it in there. It's part of our what's called the extracellular matrix. It's the tissue between our cells. And over time, the high hyaluronic acid and other biochemical components in our bodies, it diminishes in quantity, it diminishes in quality, and basically a filler is used to replace or replenish what was missing. And the filler, the mechanism of action is that it actually absorbs water. So the filler immediately causes a volume improvement, but over time, the real method or the real mechanism of how it works is that it absorbs water and fills that area. It restores volume to that area.
Okay, that's interesting. So a filler, like if you put it in a spot that's not wrinkly,
Like say
but
these little lines here on somebody,
Yeah.
or these lines here,
yeah,
or cheeks. Yeah, when you inject the material, it immediately,
plumps it up.
yeah, because you're injecting a volume of high hyaluronic acid. But that's not what ultimately, over the next several months to a year and a half, actually maintains the volume of that area. It absorbs water and retains water.
Okay, with Botox, or if you have fillers, do they wear out? Do you have to go at a certain, like, incremental times to go get more Botox or more filler? Are they absorbed into the body?
Well, they eventually, like, the effect wears off. So the Botox, the botulinum toxin has it is a non-permanent paralytic of the muscles. It eventually wears off because the way that it works, it prevents the transmission of neural signals between the nerve and the muscle because of receptors and things that are released, but those are then basically reformed by the cells. So eventually, that's why you have brand new things that are working perfectly fine that the Botox didn't affect. And so it wears off basically.
So
It's a lot more complicated than that, but yes, it's a very temporary thing. Well, not very temporary,
temporary?
but it's temporary. It's not going to last 2 years.
Okay.
But it's usually depending on the material and the patient and their metabolism, somewhere between 3, and I've had patients as long as like 9 months where the effect stays in effect.
Oh, great. Okay.
The fillers are temporary too. In the quote-unquote olden days, people were injecting permanent fillers like silicone. I don't recommend that. You could have terrible reactions to them. There's no real reversal or reversing agent for that, and it can be quite a mess.
So what happens when people get something like that injected?
It's in there for good, and if you want to remove it, you have to perform an operation to remove it. With a filler, if it's injected and someone doesn't like it, you can actually inject a material that will dissolve it. So there's an antidote for it.
Okay, well that sounds better.
But
the old ones weren't like that.
I've seen pretty disastrous, undesirable effects of that.
Undesirable. Okay, if it's undesirable,
Yeah.
I mean it's pretty tragic.
Undesirable. So the permanent ones I'm not a big fan of.
Okay. No, I agree.
The fillers do quote unquote wear off as well over time. depending on the filling material, there's different longevities. It gets into some biochemical things and properties, but the bottom line is, depending on what you're injecting, you can expect between 6 up to 18 months of a result.
Okay, and then you just have to go in and get it done again. Okay. Okay, what is a peel?
A peel is well, there's different types of peel. You can do a laser peel or the old-fashioned chemical peel. A peel is basically something that is done either chemically or through a laser to basically remove a certain depth of your skin.
Okay.
Of the face, basically.
Was the chemical peel what they originally used and the laser came later?
Yeah, so the chemical peel, they have been around for a long time. It's a bit of an art form because you have to basically prepare the peel. I mean, they come in bottles, but you can then dilute them, you can augment them. They have to be applied in a certain manner. And by the type of peel that you're using and the chemical composition and the manner with which it's applied, you can basically burn off a certain level or layer of the skin.
Okay. So 1 layer, 2 layer, a little bit deeper, depending on what the issue
by like
is.
anatomic levels, like your epidermis versus the superficial dermis. But they're interesting, they're fun. I've done them for sure. But in our office, we have a beautiful erbium laser. You go to a keypad and you punch in the exact depth that you want to go, and that's it. I think it's a lot safer, more consistent.
I was going to say.
Yeah, I'm much more confident in the results and the outcomes using a laser peel versus the old-fashioned chemical peel, but they're still very popular in certain practices.
Okay, what's the difference between the healing process? Like a chemical peel, I imagine you burn everything off. So do you have like scabs and stuff that end up?
It all depends on the depth of the peel.
Okay.
Whether it's a chemical peel or actual laser peel.
Right. What's the difference
Because they're
in
both
healing?
Not a ton. It all depends on the depth.
Okay.
So I can have a laser that's a very deep laser. Someone's got a lot of thick wrinkles on their face and a lot of sun damage, and you do a very deep laser peel. The face can be red. It requires maintenance for 1 to 2 weeks after, and it can be red even for a few weeks thereafter. Same thing with a chemical peel, depending on the depth.
Wow.
Or you can do a laser peel where you're just resurfacing gently the outer layer of your skin, where you're only red maybe for a day or two, or even a couple hours.
Really?
Yeah, so there's a lot of variability. It's not like a one size fits all. It all depends on the depth to which you're removing skin.
Okay, are there different fillers for like cheeks, under the eyes? I was reading all this. Or do they use the same filler? Oops, sorry.
No, there's a lot of different fillers.
Different ones.
Yeah, they've got different properties to them. They've got different viscosities and rheostatic properties and densities. So in some areas, like an area where, like under the eyes, there's a particular filler that I use. It's almost like injecting water because this is such a thin area.
I was going to say it's very.
It's just like one of the thinnest skins of the body here. It's extremely thin, and you want a very fine, delicate filler to get under the eyes there to fill that area.
Right.
Versus one that's like, for cheeks or for a chin augmentation, it's going to be a lot heavier and denser.
But the skin is so much thicker
and less
there.
plastic. Right, and you have your facial skeleton here, so it actually lifts off the skeleton. So heavier duty stuff for heavier lifting areas, fine things. So it's like rough carpentry versus fine carpentry. More delicate areas, there's fillers that are better suited for that. Heavier lifting areas, fillers better suited for that.
Okay, so there are different fillers. They don't use the same fillers for the different areas. Depends on the thickness of the skin, where it's located. Are fillers used anywhere else other than the face?
In theory, you can use them like for the hands.
Yeah.
People don't like the hands.
Yeah.
Knees to help with the skin here, to give it a little bit more volume. Elbows. Yeah.
Okay. So there are synthetic and natural fillers.
Well, yes. There are. And then there's combinations thereof. It gets into a little bit of technicalities, but
I was just going to say
it's kind of complicated, but kind of not.
Do they mix them? Are they just okay? So
Like you can inject one area, say with calcium hydroxyapatite, but that's actually part of that's actually made by our body. The calcium, obviously. You can do that for cheeks, but then you do a different one for around the chin. So I mean, you can do combinations, whether it's synthetic or not. Unless it's like silicone is synthetic for sure. So it's not really. We don't really break them into synthetic and non-synthetic.
okay, so but it's common to mix fillers, but
Yeah,
you'd have to
sure.
really know what you're doing.
Yeah, you should. I mean, again, different fillers for different areas. You've got different properties. With experience, well, training and experience, you'll know which ones work best for what parts. It's not one size fits all because your skin thickness, your bone density, your muscular activity may be different than the other person.
Right.
So then you can switch these around. It's a bit of an art form. So it's not just this, you walk around with a hammer and everything's a nail.
No. And you know what? As the more you're talking, the more I can see that you probably have to do a really thorough examination of who you're treating.
Yeah, you do a facial analysis and you develop an understanding of skin thickness, muscular activity, bone density. In some, their exercise regimen, which can affect things. If their metabolism is really high, there's a tendency for these things to wear off a little bit more quickly.
I was going to say,
yeah.
probably it'd be absorbed by the body more quickly.
Yeah.
Okay, so I guess my question is, do you actually have people out there who are not qualified to do these procedures who are doing them?
Sure, and obviously we don't condone that.
No.
They just had somebody in New York that was performing, a patient died from plastic surgeon that was performing body sculpting. Never had a medical degree or training, but, basically was posing as a plastic surgeon, had quite a clientele, and then had a patient die recently.
Didn't Joan Rivers die when she was having plastic surgery? She died from something like that.
It was a different thing. They were biopsying something in the
Okay.
voice box.
Okay. All right, but I mean, the procedures
There
I've
are
seen.
people out there that probably shouldn't be doing it.
Yeah.
Don't have training, don't have licensing, et cetera, that
Right.
I'm sure are in the shadows, back alleys, et cetera, et cetera.
Well, okay, so I'll just say this:
I
if you can't afford a good,
I don't think they hold up a sign and say that.
no. But I mean, the thing is like you're not going to go for a bargain basement, go to another country, like Mexico.
People do all the time.
I know they do, but the thing is, I wouldn't recommend that, and I sure wouldn't do it if I were looking to. I mean, what are you going to do, and what's your recourse? Nothing.
Well, if there's post-operative complications,
Then what?
they don't really get to ever visit with the original surgeon.
Right.
They come here. In fact, there's a fair number of people, because I do a lot of nose surgeries. They go to different countries, especially Turkey and other places in the Middle East, for what's called rhinoplasty. And if they're having issues, et cetera, they're not going to go back to Turkey for any post-operative visits or anything. So they actually come into my office, if there's problems, complications, or issues.
I guess my question is, why would they go to the trouble of going to
Cost less.
a lot less?
Yeah, because I think the exchange rate, et cetera, is it's significantly different. But you're taking a risk on the other side.
No kidding. If you have a problem, how are you going to fix it?
Yeah, you're not. Then they
You're
end up either in our emergency room here at the hospitals or in our offices on a patient we never have done surgery on. Of course, we take care of them.
And you don't know what's in there either.
Well, we don't turn them away. I mean, we take care of whatever we can.
Wow. Okay. So what do you see? What are the most common procedures that you see on a regular basis?
I do a lot of nasal surgeries, either for noses that aren't breathing well, noses that aren't looking good, from trauma, or just, the luck of the Irish, I guess, or their ancestors gave them a bad nose.
Yeah, right.
Or a combination thereof. The nose doesn't breathe well, and they don't like how it looks. So I do a lot of nose surgeries. I do a fair number of surgeries where we're lifting the eyebrows and foreheads when they've dropped and they're causing visual fields, or for cosmetic reasons.
Yeah.
Upper and lower eyelid surgery. Endoscopic surgery. We use there are techniques for mid-face lifting, and the brow and forehead, where we use endoscopes.
What are those?
They're basically minimally invasive approaches through the hairline
Oh,
to lift forehead and eyebrows, lift the cheeks up, using basically telescopes through 1-inch incisions hidden in the hair.
oh, that's kind of neat.
Yeah.
You can't see anything.
Right.
Okay, I have one question for you, and we didn't go over this, or I didn't even tell you I was going to ask it. But there was somebody that I ran across who was a resident here who split her earlobe.
Oh, we fix a lot
Can
of
that
those.
be replaced?
Well, we don't replace
I
it.
mean, repaired.
Absolutely, 100%. I
Okay.
actually do a fair number of those.
Okay, because lobes get long from
Those
the
are fun to
heavy
fix too,
earrings.
because the patients love it. It's an easy surgery. We use dissolvable stitches. We get, the results are great. They do have to wait. I have them wait about 4 to 6 months before re-piercing. We can actually inject filler in the earlobes to give it some more strength and resilience too, by the way.
Oh, that's
And it
really
makes it look
interesting.
better.
Okay, so what other than the eyelids, I mean, and I really think those surgeries are important, especially for people as skin sags. You know what I mean? It can affect a lot of
Yeah,
your
sure.
daily activities. But what are your favorite things to do?
I like the endoscopic brow lifting, endoscopic mid-face lift using telescopes.
Okay, and how do you do that though exactly? How do you get this up through the hairline?
Yeah,
Or
so there's
do you
incisions in
do
the
it
hairline here, under the gum line actually. And
Under the
lift,
gum line?
basically lift all this off the underlying facial bones, and we lift it up. We use these things to lift them, and that melt over 9 months. But by that time, the cheeks are in the new position. It's one of my favorites because it's very fun to do, because you get, the approaches are great. There's not large incisions. There's not a lot of bleeding and things like that.
Okay, and what about under the neck?
Yeah, we do neck lifts too, of course.
Okay, and are those complicated procedures?
They can be if someone was a smoker, or they have a bit of a bleeding disorder that they didn't talk about, or they have. We give our patients like 4 pages of things that they have to avoid before surgery and
Yep.
after, so their blood is not too thin. Well, people say, "Oh yeah, I totally, I looked at all this," and it's like you're in the middle of an operation and their blood is very thin, so that can make things complicated.
Yeah, because they won't stop bleeding.
Well, it's hard to see and it requires more cautery, you know what I
Right.
mean? So, but they're usually pretty straightforward.
Okay.
Yeah.
So they get all the stuff ahead of time. So what do they
Absolutely.
do? Come in first for a consultation.
Correct.
Okay, and then you tell them what you can do.
Well, they go over their desired goals and things like that.
Okay.
For the most part, thank God in my practice, they're very reasonable. But imagine this: you're dealing with the public, and there's people that want things that are rather unreasonable or
Above
they have
expectation.
above expectations,
Yeah.
or the defect that they want to correct is so minor, but they have it as some huge, massive, problem. Those really are not good surgical candidates, basically.
Right. Okay. Now
But no, so we do consultation,
Yeah.
physical exam, which includes the full medical history, surgical history, all the medications are on. We scrutinize for rheumatologic disorders, connective tissue disorders, which can make the surgery much more difficult,
Yeah.
or it can lend towards poor wound healing. Okay. Anything that would make their blood unusually thin, whether it's intrinsic to them, they have
Blood
a
thinners,
bleeding
for
issue,
one, yeah.
or even supplements, protein
Oh.
powder, protein shakes, vitamin E, fish oil,
Wow.
multivitamins. All these things can make the blood very thin.
Really?
Energy drinks are one of the biggies.
Yeah.
Marijuana is a big one.
Oh, yeah.
It causes terrible problems with bleeding, terrible problems with anesthesia, for the amount of anesthetic that's required, and then controlling blood pressures during anesthesia. It's a lot rockier.
Wow.
So
Okay.
we do a very heavily screening and vetting process with this.
Well, I think it's important because you can go stop in at any store, right, and do that, and people don't think it does anything but affect your whatever.
Well, they think it's good for them, which I'm not saying it is or it isn't, but it's not good during an operation when your blood is not clotting.
Right.
Yeah.
No, I totally get that. All right, so thank you so much. I really appreciate you coming in and talking about this. When we did the ear, nose, and throat stuff, I was shocked when my friend was telling me, oh, Dr. Carron does this and that. And it's like, I want to do a show on that. So I really appreciate your time. Leave us your information in case anybody watches it and they want to call. I think it's very important to know the people that you have doing these procedures must be qualified, highly qualified.
Yeah, it's very important. Training experience is critical.
Yeah, and I imagine, I wouldn't go to the bargain basement to get a nose job or have a facelift. I would not do that. But anyways, thank you, Dr. Carron.
Always a pleasure.
Oh, it was my pleasure too. And thank you and the viewing audience for being with us today. Hope you gained some interesting and useful information. Thank you.